Hello, this is Dr. Lewerenz, Longevity Health Institute. I am going to name this video something that may sound a little crass or funny. This is more of a sombering video, but I want to share it with you because of how impactful it is on every single one of you out there. And if you can make this viral and share this with others, I promise you can save lives. And that's how not to die. So unfortunately, or fortunately, however you look at it, yesterday in my personal life, so meaning not in practice, this is not a patient, I was not even supposed to be there, but I was at a country club pool and I was swimming with my nieces and nephews, and fortunately also my best friend, an ER doctor that actually, ironically, 20 plus years ago, helped train me in ER medicine over at the old Garden City Hospital and Botsford Hospital. And we were swimming and playing with the kids and that, and some gentleman that we actually don't know, actually we're talking to him minutes prior, just, saying hello, and he knew a family member of mine there. He proceeded to fall face first and go into cardiac arrest right alongside the pool in front of his wife and children and everyone there. And I was swimming and my wife said, you got to get out, you got to come and help and everything like that. And of course, the ER mentality and adrenaline kick in. And fortunately, the real lifesaver is my buddy, Rick Trikoff, Dr. Trikoff. He really, he's got that experience, and again, one of my mentors, teachers. And anyway, hey, so the wife and, me and him and another couple fellows, everybody's doing their part and everything. And he was actually multiple times what we call coded, no pulse, no respiration, literally cyanotic blue, and right under my hands and his hands and the wife's hands, and obviously 911 called and on their way in that. And as we did CPR and I proceeded, not to sound graphic here, but crack ribs and pound on his chest, etc., and all those things, fortunately EMS showed up with a AED device and essentially brought him back. He was in and out of consciousness and pulse, or not consciousness, but pulse and some respirations occasionally, but he was defibrillated out of a rhythm like VTAC or VFib, and long story short, he was brought back. So why am I doing this video? Well, let me tell you, that's something that'll wake you up, obviously, and not in the hospital setting where I've done that, obviously, many times. But not having the tools, the equipment, etc., having family and friends around, people crying and all these things, it really, really is awakening. And I will tell you, it was very, very, very emotional last night. Called my mother, called my friends, hugged my wife a million times, tears down her face and that. Because life is so fragile and everybody is healthy until they're dead. I hear that all the time, especially in men. He was so healthy, he takes no medicine. Well, I don't want to get into specifics about this gentleman because I don't know him, okay? And I did have the pleasure of speaking with his wife this morning, and I'll give you a follow-up on this. But I will tell you that there's two things I want to encourage you to do, and why I'm telling you this story. And that's why I said how not to die, is because there are things that don't accept, number one, that are okay or normal, and don't lie to yourself about some of the things that you might think are okay or well, because now what, in our world and society, they're normal. Being obese, smoking, a lot of people smoke. Heavy drinking, all my friends, we all party and drink, okay? The weekend warrior or whatever, okay? Stress, gosh, just today, Monday here, in my office, women and men. Man, did we talk about stress today and their adrenal function and what stress is doing to their sleep patterns and all that. It's just because it's common does not mean it's normal, okay? Life's about balance. Life's about embracing others, hugging people, loving them, helping the community, having a community, okay? Having purpose, okay? But sometimes I think we just have to pump the brakes and go, hey man, am I sleeping good? Am I really balanced? Have I seen somebody that's really looked into my physiology? Okay. And you'll be shocked when I tell you this gentleman's age. Okay. But has somebody really looked at my physiology? Am I really as healthy as I tell myself I am? And I might be lying to myself. Okay. And I'm not picking on anybody, but I'm picking on everyone, picking on somebody. And that's men. We are the worst. And you've seen other videos, or at least live videos I did through Facebook. Men, we're the worst. We lie to ourselves, everything's fine. Guess what? This gentleman had back pain significantly for a week or more, complaining to his wife, blah, blah, blah. And here's the thing, and look, at that was a sign, okay? Put it this way, he's complaining enough, not one day and gone, but enough to be complaining many times about it, okay? And that was a sign, okay? Now, what's his story? Let me give you this, the final here of what his story is. Well, he had a full occlusion of one of his widowmaker, his LAD, is one of his coronary arteries, and at least 80% of his right circumflex. And he has what they're working him up here for right now, a hypercoagulable condition. But they don't really know why this happened, because when they did his heart cath and they did the stents, he did not have a lot of plaque. He had a thrombus, which means blood clots for the heart attack. And that caused him to go into these arrhythmias. So essentially massive heart attacks without a lot of, long history of plaque and disease, okay? But enough to cause an arrhythmia that can kill you, okay? She's not real happy right now because she's like, I don't have an answer. Hopefully we find some answers. His cholesterol was perfect. His blood sugar was perfect, okay? Yes, he was obese. That is not normal. Being overweight, even 30, 40, 50 pounds, and then 100 plus, whatever it is not normal. Yes, it's everywhere. In fact, commercials now, it's okay to be massively overweight, okay? Now, I'm not saying I'm weight shaming. I'm not saying that we all have to be perfect, but I will tell you something, is that if we're not cognizant of weight, okay, we see it here in COVID, one of the biggest risks and mortality issues related to COVID, okay, is obesity. Why is diabetes, okay, almost nearly 40% of the country and rising, okay? Why are we living longer but sicker? And a lot of these are related to inflammation and weight gain and diet and all that. So we gotta check in, and men, we're the worst. We are the worst. And you have wives, you have mothers, you have children. I mean, the wife and the child was at the poolside watching this, okay? Point being is that these are real things. This gentleman was 39 years old, 39 years old, okay, with no known medical history, okay? At least to my knowledge, is what the wife told me this morning. He is alive and well. He is talking. He actually cannot believe what happened. His back pain, ironically, now is gone, and she couldn't believe it. Like, he's actually acting like he feels even better, okay? My point here, though, and to tell you this, how not to die, is the first step is we got to get checked out. We got to go to somebody that's looking at, the real functional physiologic issues, okay? Looking at, are you hypercoagulable? Is there a weight issue? Why do you have obesity? Do you drink too much? I don't know. Do you smoke and we need to help you get off of smoking? What's your diet like? Okay. And again, I don't know this gentleman. None of that's judgment. My point is, I'm trying to encourage all of you, particularly men, to be honest in the mirror with ourselves about these things, because I have 3 other patients here, 3 other patients, 2 women widows and a man widower, okay? And they've lost their spouses, and all 3 of these people, okay, are under the age of 55, okay? I mean, and what happened? Well, things that could have been avoided, okay? Things that could have been avoided. Now, to talk a little bit more about that on the medical end, the way my brain works, I woke up this morning and I did get a message, about the individual, the gentleman who was doing, better and alive, and, you name it. He coded even at the hospital, and the hospital did awesome stuff with him, and the doctors, etc., and the EMTs, and you name it. Fortunately, he was poolside and not hunting in the woods or somewhere where EMS couldn't get to him, because CPR wasn't going to do it. Let me just tell you, okay, it bought him time. So God was with him, God was with us, and hey, it's a good day, But I want to tell you though, is that there's got to be a reason, and that's how my brain works. And I talked to the wife and I said, it's my pleasure to see him, to look into possibly physiologically why, because don't accept that he has a hypercoagulable state and they don't really know why. Whether it's genetics, whether it's iron, whether it's some reason that he is, what we call polycythemic or thrombotic, but there is a reason. Whether, and I talked to her about some details that I had thought about already and she was unaware of. Anyway, point being is he will get checked out and he will be fine, but could have been prevented, and God was there with him to, help him and his family and his wife and children, okay? So men, we have to do this. We have to be present for our families and loved ones, because it's not just our life, it's their life too, okay? So let's be real about it. Let's get good care, get prevention. Let's check in, keep each other accountable, if you will. Okay, so we can all live well and do things that are honorable and good for our families. And hey, the other thing too here is that most of us that have an event like that aren't that lucky, for sure. Okay, I had one in my life, myself and my family. So I hope this is informative. Yes, kind of sombering, although I'm telling you, he's alive and well right now, stable and in good hands. He's going home to his family likely in a couple days. So amen. But get checked out. Check your cardiac risks. Don't lie to yourself. Don't believe that eating and drinking and being significantly overweight is okay. All right. And get real good preventative looks into your health. This is Dr. Lewerenz. Be well.